Join our YouTube channel to learn surgery in a simple way. How many things you know in medical field, which are named Kocher? Let's see 20 such things. Number 1. Number 1 is obviously the great surgeon, Emil Theodor Kocher. Born in 1841, Kocher was a Swiss doctor who received the 1909 Nobel Prize for his work on thyroid gland. He was the first surgeon to ever receive a Nobel Prize in medicine. Kocher worked under another famous surgeon of his time, Theodor Billroth. Kocher not just pioneered safe thyroid surgery but also contributed to neurosurgery by his work on reducing intracranial pressure by decompressive craniotomy, his contribution to anesthesia and hygiene practices, which were immensely responsible for his surgical success. Number 2. Kocher's forceps. Kocher's forceps is a surgical instrument with serrated blades and interlocking teeth at the tips, used to control bleeding. Number 3. Kocher's point. Kocher described a point in skull which can be used for creating an entry point for an intraventricular catheter to drain cerebrospinal fluid from the cerebral ventricle. This point is 1 to 2 centimeters anterior to the coronal suture in the mid-pupillary line. Number 4. Kocher maneuver. Kocher maneuver is a common surgical maneuver to expose structures in the retroperitoneum. It is done by incising the lateral attachments of second part of duodenum and lifting duodenum with pancreas towards left side, exposing posterior surface of pancreas and great vessels, aorta, IVC, left renal vein. Number 5. Kocher-Deber-Samerlane syndrome. It is hypothyroidism in infancy or childhood, characterized by lower extremity or generalized muscular hypertrophy, myxedema, short stature and cretinism. Number 6. Kocher's incision. It is subcostal incision used in open cholecystectomy, classically given about 2 finger breadth below right subcostal margin. Number 7. Kocher's incision. Another Kocher incision is used in thyroid surgery. It is given about 2 finger breadth above suprasternal notch along skin crease. Number 8. Kocher sign. It is an eyelid phenomenon in hyperthyroidism. In fixation on a fast upwards movement, there occurs retraction of the eyelid. Number 9. Kocher's test. Kocher's test is done in large thyroid swelling, slight pressure on the lateral lobes producing stridor is Kocher's test. This will be positive when thyroid swelling has compressed the trachea from both sides, giving rise to scabbard trachea. Number 10. Kocher's method. It is for reducing subcoracoid dislocations of humerus. Number 11. Kocher's vein. Superior thyroid vein and middle thyroid vein drains into the internal jugular vein. Inferior thyroid veins drains into the brachiocephalic vein. Occasionally a fourth vein is observed between middle thyroid vein and inferior thyroid vein draining into internal jugular vein known as Kocher's vein. Number 12. Kocher thyroid gland dissector. Kocher thyroid gland dissector is used in the mobilization of the superior pole of the gland. Number 13. Micro-Adson Kocher forceps. These forceps are great for holding delicate tissues during procedures. Number 14. Kocher S position or thyroid position or the rose position. In this position, the neck is extended, increasing the space between the clavicles and the jaws. The head end of the operating table is kept raised by nearly 15 degrees to reduce the venous congestion. Number 15. Kocher's approach in upper limb surgery. The Kocher approach involves incision of the lateral collateral ligament to gain access to the radial head. It exploits the oblique interval between the anconeus and the extensor carpi ulnaris. Number 16. Kocher-Langenbeck retractors. Kocher-Langenbeck retractors are used to retract soft tissues in different types of procedures, like thyroid surgery, open hernia surgery, etc. Number 17. The Kocher-Care criteria. Clinicians use the Kocher criteria for aseptic arthritis diagnosis in children. Kocher showed that a history of fever more than 38.5 degrees Celsius, non-weight bearing, an erythrocyte sedimentation rate more than 40, and serum white blood cells more than 12,000 were highly suggestive of septic arthritis of hip in pediatric patients. Number 18. Kocher-Langenbeck approach. The Kocher-Langenbeck approach is an approach to the posterior structures of the acetabulum. Number 19. Kocher-Volkovich sign. It is present in acute appendicitis, pain starting in the periumbilical region or in the epigastric region with a subsequent shift of the pain to the right iliac fossa. Number 20. Theodor Kocher Institute. Theodor Kocher Institute is situated in Switzerland. Apart from these, there is a prize for outstanding young researchers in any field at the University of Bern is named Theodor Kocher Prize. It is awarded yearly since 1915. Plus beyond medical field there is a lunar crater named after Kocher in lunar South Pole, and stamp named in honor of Kocher. Join our YouTube channel to learn surgery in a simple way.